Hello everybody and welcome to this walkthrough of your mock exam, paper 1, medicine and the trenches. Just thought it'd be a better idea to do this with a bit more detail than trying to do it in class when everybody's got different things to think about and to work on, and you can do it at your leisure as well. So let's get started. This will work best with your papers in front of you, so you can obviously pause the video on each question to have a little look at what you put, maybe what you needed to put, and get some ideas and maybe what you could have talked about. But you can obviously watch it without that as well. It'd just be handy having your paper in front of you as well. So let's get started then with some general feedback of the paper overall, rather than specific questions that will come in the rest of the video. Please remember your time management. On this paper especially, you've got to do a lot in an hour and 20 minutes. So you need to be spending about 25 minutes on the trenches and the rest of the paper on medicine, about 55 minutes. Remember, we've told you to go backwards once you get onto the medicine section, so do the 16 marker first, then the 12, and then the 4. This is just in case you run out of time. It's better to run out of time on the 4 marker than it is on the 16 marker, where you won't get your conclusion done, and it's a really important part of that question. Okay, don't make up your own questions. That's happened in a few of your papers when marking them. Don't sort of take the question where you want it to go. Just answer the question that they've given you. The easiest way to do that is to, of course, focus on the words of the question all the time. Work on your language, your signposting language. Remember, we've said to make it really clear to these examiners what your point is and what your paragraph will be about. So use language like one feature of whatever the question is. Use the words of the question. If it's a 12 marker, make sure you're saying one reason why whatever happened was. You'll see a bit more specifics as we go through that question later on. And if you're doing the big 16 marker or any essay that requires a judgment or a two-sided argument, make sure you're showing on the one hand and then talk about all of the things on that side of the argument, and then flip over on the other hand to the other side of the argument. So that was just some basics there from the overall of the paper. So let's move now ourselves into the trenches paper, which is section A of your medicine paper. Remember, shortest amount of time on this, 25 minutes, and get straight into it. The first question is relatively easy. It's 2 marks. You do 2 different features of 2 different things, but they should be fairly straightforward. The first one in your paper was the gas attacks. So you could choose anything at all about gas attacks. This image that's just cropped up here, you could pick any detail from that at all. Remember, you just need to identify the feature, which we'll look at in a minute with the model answers, and give some supporting detail. Most of you talked about mustard gas and or chlorine gas. Some of you talk about both and you don't need to, so a little bit more than you needed to do. Phosgene is just another one, another gas attack, but any feature at all about gas will be valid for this. As I say, this is relatively easy in terms of the rest of the paper, and you did generally really well on this question, so well done. So just pause the video and have a quick read of this image, just to remind you of the details that you might need for your real exam in the summer. And when you're ready, move on and we'll have a look at some model answers. Okay, so the actual question for 1A on your mock paper was describe one feature of gas attacks on the Western Front. Just make sure, as always, with the wording of the question, that you do understand what it is that it's asking you to do. So just take a few seconds to read it carefully. In this case, it's really straightforward, and it is only worth 2 marks. But make sure you understand what this is asking. It's asking for a feature of gas attacks on the Western Front, which is pretty open and could almost be anything. So remember what we need to do first of all in this question. It's easy, but we've still got some hoops to jump through to make sure we make it very clear to the examiner what we're doing. So we have to identify our feature, which we've done here in this opening sentence. One feature of gas attacks on the Western Front was the surprise attacks. So I have chosen as this example that a feature of the gas attacks was that they were a surprise attack, weren't they? They came out of nowhere. So that's the feature. Now I need to have some supporting information for that. So then for the second mark, would say something like, often the attacks would come out of nowhere and the soldiers had to quickly put on their masks or risk serious injury or death. Now, that might seem a little bit simple, really, but that's the point. This question, it is. Identify your feature and support it with some knowledge, but make sure that your knowledge is related to the features. So don't say one feature is a surprise attack and then start talking about, the symptoms of mustard gas. It needs to relate back to the actual feature that you've identified. And you could say anything in that follow-up, in that supportive bit about how they might do it at certain times of the day or when the weather was fine, whatever, as long as it's related to that. And of course, you could think about some other features, which we'll have a look at in a sec in the next page. But things like the different types of gas and the symptoms. Now, that image we've just looked at will be your reminder of that, but we'll have a little look in a minute now at some good answers or some other detail that you could pick if you chose to identify a feature of just one of the types, so mustard gas, chlorine, etc. Okay, so hopefully that makes sense and you can see just how easy this question actually is. Okay, so let's think about some of these other features then that we could have talked about. So you could have identified the feature being mustard gas was used. And the follow-up detail that you'd pick, something along the lines of it was either odorless, it worked within 12 hours, it would cause blisters inside and outside the body, it could go through clothing. Any detail like that is a supporting detail that will get you your 2 marks. And anything else that you know that you think will be relevant, put it in. But we're not writing essays here, remember, it's just 2 marks. So get this question done as quick as you can. So we've identified mustard gas and we've given some detail. You could also do the same thing for chlorine gas. So you might say that it was first used in 1915, it led to death by suffocation, turned water into acid, and of course our body is full of water, especially inside. Any of those kind of details. You could mention about our first soldier to experiment with treatments, like peeing on cloths or whatever. Any knowledge at all that's related to chlorine gas and treatments of it or preventions of it, and then maybe mention that gas masks were introduced in 1915. You could do phosgene gas, of course. All of these are on the earlier image to remind you of the detail. Or you could go a little bit curveball and do a feature that it's quite tricky to use, mentioning that gas has to be, the attack has to be planned quite carefully, but they're risky because if the wind changes, it could blow back into your own trench, or details like that. So you can see here that there's quite a lot for you to say in the gas attacks question, if we get a gas attacks question in the summer. But the knowledge that you need is kind of minimal, but you do need to be clear that your knowledge matches up to the feature. All right, so again, hopefully that makes sense for this question, and then we'll move on to the second feature of your mock paper. Okay, so flipping over to our second features question, another 2 marker, another nice and easy one. On your mark was the features of the regimental aid post, the RAP. Okay, so let's get straight into that. Another easy one, and in actual fact, probably this is a lot easier than even the gas, because there's so much that you know just naturally, but you need to make sure, again, that you technically do this properly with the feature and then the supporting detail, not just a random sort of everything I know about the RAP. That probably still will get you 2 marks, but try and keep it really technical and really tight to the question. So the question is, describe one feature of the regimental aid post, okay? Now, it's important that you, again, are sure what the question is asking you for. It isn't about the evacuation chain as a whole. It's not asking you about the CCS or the ADS or the base hospital. It's asking you specifically about the RAP. So make sure what you're saying is about the RAP. Okay, so the feature that I'm going to identify in this example is that it was close to the front line for immediate treatment. That's obvious. That's probably the thing that most people talked about, was that it was close to the front line or about it being basic first aid. So that's the feature identified. You can clearly see that's 1 mark right there. Okay. The RAP was around 200 metres from the front line in the trenches and was close to allow for immediate first aid or to stop bleeding. So I've added some supporting detail, and you know, as you're probably watching this, that you could have gone on for ages about this particular feature, but we just don't need to. We've got 2 minutes to get in and out with this question, but we've given a good fact, 200 metres from the front line. We've talked about immediate first aid or to stop the bleeding. If you really had a bit of time and you could write quick, maybe you could add some feature about how this was important to get them back to the front line as quick as possible. I don't know, but we don't need that. Okay, so as a question goes, this is really straightforward, and there are many different things. We'll have a look again in a sec at possible answers that you might have picked, or some of it you did pick, other than this obvious one about its location. So with some good revision, you'll be able to answer anything on the RAP. Source questions, because you're just bringing in the same knowledge. So if we do get a question in the summer on the evacuation chain, just make sure that you know about each of the sections of the evacuation chain: RAP, ADS, CCS, and base hospital. And we are good to go, absolutely. So let's have a look at some of the other things that you could maybe talk about in this question. And the features would be something along the lines of they're located inside the trenches. All right, I've sort of mentioned that a little bit, but we could go into some more detail if you want to focus on that they're usually in the bunkers, but could also be in the communication trenches or deserted buildings in certain parts of the Western Front. Maybe there's an old barn or something that if we've got some space and an old farm, I don't know, whatever it might be, you might have that. So that's not saying every RAP is the same. We're just sort of saying, generally speaking, this is what they are. Another feature would be that soldiers could get there easily. Obviously, it's in the front line. They could walk to the RAP themselves, or if they're even more injured, they could be carried by the field ambulance or the stretcher bearers. And again, you could add something in there, perhaps that it was ran by a regimental medical officer, RAMC, who was in charge of the field ambulance, and you know how many people it could hold, maybe one RAMC for so many soldiers come in, whatever detail. The thing with this question is there's loads you could say. It's important that we get in and get out quickly. And the final example that I think would be useful to think about, and what lots of you did talk about, was that it's the first part of the evacuation chain. So just make sure, a couple of you, when you did that, you then went on to talk about the rest of the evacuation chain. Don't do that, because this question is about the RAP. So it is the first bit of the evacuation chain, that's correct. Talk about how the medics at the RAP would try and fix the wounded quickly to get them back to the front, stop the bleeding, basic first aid. It's the immediacy of the thing, isn't it? It's really immediate. And everyone who mentioned that mentioned the M on their heads for morphine, so that the next person up the evacuation chain knows that this soldier has already had some morphine. Now, again, another feature just coming to mind as I'm talking to you here, you could talk about the danger of the RAP. Because it's so close to the front line, of course, it's vulnerable to shells and explosions and all sorts of things. So you could talk about that. So hopefully you can see, actually, this isn't bad as a question. In fact, question one generally, having looked at both of them, gas and the RAP, they should have been done well, and they were done well. There's no real problems from this question from what we've marked, so well done. Just make sure that you do know that specific knowledge, okay? So then we move on to our source question. This was a bit of a mixed bag, really, considering we've got our sort of routine for this one. But okay, let's talk through it, and hopefully you can see on your paper what we need to do to improve. So the question is asking us how useful are sources B and C for an inquiry into the causes of illness and injuries on the Western Front. So a nice big open topic. Causes of illness and injuries is the focus. So generally about 16 minutes to on this question, probably maximum, depending on how quickly you've done question one really. Do a paragraph on source B first and then a paragraph on source C. Try not to mix or merge your paragraphs. Make it nice and clear to the examiner that this one is source B and this paragraph is source C. You do not need to compare them. You don't need to say which one's more useful or which one's better. Just two separate paragraphs. Okay. Each paragraph should definitely be starting with source B is useful for an inquiry into the causes of illness and injuries on the Western Front, because that's the words of the question. Whatever the words of the question is, always start with source B is useful for an inquiry into, and whatever the words of the question are. All right, then begin by saying the easiest way into it is source A says. Pick out a quote from source A, that will be your content, remember, and then follow that up with some of your own knowledge relating to that quote, but keep it focused on the question, in this case, causes of illnesses and injuries. Continue again by saying source B also says, so pick out your second quote, and again back that up with some own knowledge relating to the quote and the focus of the question. So now we've got COCO, essentially, CO. We need to end this first paragraph with two pieces of provenance. So what makes the source useful in terms of who made it, when was it made, what is the source, why was it made, etc. Any of those things. It's a little bit trickier when you're doing the why was it made. It's not always obvious. But if it is obvious, like in this exam where you get to talk about a museum, that is very obvious. So we'll talk about that in a sec, but that's a nice easy one to pick out. So remember, was it made by a surgeon, a general, a manager, a boss? Of course, if it was, that makes it more useful because they have a bigger picture. Was it a soldier who wrote a diary, for example, at the time? That's useful because he's basing it on his actual experiences. Remember, you need to say, and you'll see in the feedback in a sec, you need to be saying why that makes it useful. All right, so let's have a little look. Okay, obviously then you do the same for source C. Also remember, before we move on, that all sources are useful. Try not to be negative. Try not to find faults with the sources. Always try to find something positive for all of the sources that you see, and that's exactly the same in the Germany paper as well. All right, so the first source, source B, is a written source relating to the conditions in the trenches. All right, so the content that you could pick out, any of these things, just need two of them. You could pick out a quote that talks about being knee deep in mud, not to show our heads above the parapet, etc. Just put them in quotes. Source B says. If you can, try and make an inference, remember, in these source questions. That will always get you some marks as well. In this case, you could be inferring the fact that he says that they weren't not being told about them, possibly didn't want to put the soldiers off, Although you can see by December 1916, you should know with your own knowledge that recruitment at this point was compulsory, so it wasn't really a case of trying to put them off. They had to sign up, didn't they? So there are two things you could think about, and then your knowledge to back those two quotes up. You know the conditions that lead to trench foot, so tell the examiner. Don't leave it to be implied, assuming they know what causes trench foot. Tell them. This is your own knowledge, and trench fever, of course, as well. Maybe talk about the duckboards a little bit. They try to lift them out of the water. Snipers were always watching. Talk about what you know about the snipers. You know, sometimes they put helmets on sticks, remember, to see if a sniper was watching or looking. And head injuries are very common. Remember, the trenches were dug to the height of the tallest man. The sandbags are there to protect the frontline soldiers from shrapnel and artillery. And of course, the Brodie helmet was introduced in 1915. So this is all knowledge that you could introduce to support those two quotes in this source. And then the provenance. So we need two pieces of provenance. Remember, why, who made it, why was it made, when was it made, what is the source, etc. So in this case, we can see the when is December 1916. So you want to be saying this makes it useful because this is in the winter. So you know that conditions are worse. You also know that the Battle of the Somme had recently finished. So this guy's obviously got some experience of what it was like to fight during the Somme. It's an oral testimony, so make sure you give the guy's name as well. So say Walter Herr in your exam, not just this was from a soldier. That helps us just be a bit more specific. That makes it useful as well because he's recalling his actual experiences. And of course, this is where we can get into the idea about things being typical. This is obviously only Walter Herr's account, but you can read that and you can say that if you spoke to another 100 soldiers, they would all say generally the same thing, which makes what Walter's saying much more useful. Please remember to use things like that in your answer. And then the most simplest, I think, provenance in this case, it isn't always the case, remember, but when it's a museum, it definitely is easy marks. A museum is going to be more useful because their exhibitions that they put on for the public, they have to be accurate. And generally speaking, for a museum's exhibition, they will have had teams of historians who've ploughed over all the data, all the detail, all the quotes, all the diaries, any source that they've used to make sure that it's accurate and cross-reference other sources. So you can be absolutely sure that what this source is saying is true. So hopefully that makes a bit of sense. Maybe go back now and pause this video and look at your answer and see if there's an opportunity for you to pick up some of those things in there and definitely get yourself some extra marks. All right, so generally speaking, we're looking maybe for 4 marks out of 8 for this first source, and we'll get our other 4 on source C. All right, so as I said before, don't say it's made by a soldier so it's useful. Say why that makes it useful. So source C is a photograph. Usually people might think this is easier, but I don't think so. I think a written text is a little bit easier because you can just pick the quotes directly out. But as the same thing goes, essentially instead of saying source C says, in this case you'll say source C shows. So this source is about a photograph. We can see from this image here, there's 2 soldiers in a flooded trench after the Battle of Passchendaele on the Western Front in 1917, and it tells us the photograph was taken by the British Army. So we can start thinking about that provenance, but remember we're going to do that at the second half of your paragraph. So we'll start with the content again that you could pick out. So source C shows 2 soldiers standing knee-deep in mud. It also shows some barbed wire, it shows the sandbags, and it shows the filthy conditions and the collapsed trenches, as well as the Brodie helmets. So with those things, if you pick any 2 of those things, you then need to support them with that own knowledge. So conditions that led to the trench foot, again, say what you said before. In real life, you probably wouldn't have 2 similar sources like this, where you could probably say the same thing. But you can get on with that anyway. It's a trench fever. What causes it? Dysentery, you know, the dirty water. You get the duckboards in again. You could say why they built the duckboards. You can see it in this picture, why they needed the duckboards. What are the sandbags there for? Give your own knowledge about that. They're wearing those helmets from 1915, the Brodie helmets, because obviously they're expecting some head injuries based on experience. We know that soldiers also drowned in the muddy shell holes, and it was hard to transport the casualties, those stretcher bearers. So there's a load of own knowledge that you could definitely bring in to support 2 of those quotes. Okay, so provenance on this one again, 1917. So you know that's around the Battle of Passchendaele, which was the muddiest battle of all, the whole war. So many casualties, drownings, the horses, the transport, everything was just destroyed in this battle. So it's a photograph. Some of you have said it's a photograph, therefore it's useful. That's not helpful. It's useful because it captures an absolute moment in time. That is accurate. That is what the camera saw. And again, like before, although it is only one photograph, it's very, very typical. It's a typical scene from anywhere on the Western Front in 1917, especially during the Battle of Passchendaele. Whatever photograph you see, you will generally see a similar scene as this, therefore making it even more useful. All right, and it's taken by the British Army in this case, so here's a slightly different why. Maybe they've taken this photograph for training purposes, so it would need to be accurate, or if the army are taking it, they're obviously wanting to show somebody this, perhaps the government, or for experiences. But the fact that it's taken by the army makes this a whole lot more useful. All right, so there's our two sources done. You can definitely see if you've got around 4 out of 8 for both of them, then chances are you're lacking the second content and second bit of old knowledge, or lacking some provenance, but it should be easy to see where you're getting your 4 marks from on this question. As always though, if you're not sure, bring your paper to us and we'll talk you through that one-to-one. Okay, so then we need to get onto the follow-up question. It's 4 marks, so about 4 minutes, and we expect this to not be done so well. We haven't done a lot of work on it. However, it is a little bit more straightforward than perhaps some of you have made out. So let's have a little look at it. So that's what it looks like on your exam. And the first bit we need to think about is this is telling us to study source B. Now we've just done source B in the previous question, so we should have a rough idea about what source B is about. Okay, so make sure though everything that we talk about in this answer must be directly related to causes of illness or injuries, because that's what's in the question. So don't make something up that isn't to do with causes or illnesses. So let's see, so the detail in source B, here's source B just to remind us a little bit. So in my example, I'm going to pick out a quote from source B that is related to injuries or illnesses. So you can see now I have picked out, we were told we hadn't to show our heads above the parapet because there were snipers. That's going to get you 1 mark. It is literally a quote straight from the source. As long as it relates to the focus of the question, you will get a mark. So every single one of you should be getting 1 mark for this question at the very, very least. Okay, we then need to ask the question about that quote to find out more. This is what historians do to find out more. It should be a really open question, okay, so nothing specific like how many times did you go to surgery or something, really big and open. So you can see on my example, the question I would ask in this particular case is how many soldiers got injuries from the enemy snipers? Can you see hopefully how that's nice and open, but is related to the quote that I have picked out for the first little section. All right, we now need to say what source we could use to find an answer to our question. This now should be really specific. Don't say a diary or diaries or source B or source C. It doesn't mean that. It means the sources that we have learnt about that can give us information in this topic, in this course. Newspapers, photographs, army records. But remember what we've told you in class. Generally speaking, you will almost always be able to get away with saying medical records from a CCS and the base hospital on the Western Front. Generally speaking, that will be enough, especially if our question is related to injuries and illnesses or how they treated things. So go with this as a general rule. Try and get medical records from a CCS or base hospital on the Western Front. It might be a RAP or the ADS, depending on what it is that you're talking about. If it's a stretcher bearer, then it may well be something more closely linked to the frontline trenches, so the RAP or the ADS. In this case, we are trying to see how many soldiers got injuries from the snipers, so chances are if they've got a head injury, they're going to be going to the CCS or the base hospital. Hopefully that makes sense. So then the easy bit really is once we've got our source, we need to just say a little bit about how that source would help answer our question. So in this case, the question that we've asked is how many soldiers got injuries? So I have written here that this source would help answer my question because it would say in their records what injury the soldiers were admitted with, and I could work out those that were there from sniper bullets just by reading around. You know, obviously if someone's got a bullet wound to the head when they were in the trenches, because they'll have some detail, I can safely assume chances are that was a sniper who got him. Okay, so hopefully when you see that one, you feel a little bit better about that question and definitely can have another go on that one in your own paper if you didn't manage to get any marks or just 1 or 2 marks. It's not quite as bad as perhaps we've made it to be. All right, so all of that said is about 25 minutes and then we need to very quickly then get onto our medicine paper. For the purpose of this video, we are going to do in the right order, so 4, 12, 16, but please remember in real life we'd like you to answer the questions backwards. All right, so about 55 minutes on medicine. It's a massive course. A lot of you get a little bit stressed when you think about medicine because it's so long ago and so big. But remember, there's a general overview of this paper is what are the causes, treatments, preventions in the 4 time periods, and generally speaking, did things get better or worse? Okay, progress. So let's
On
go.
with it, and let's look at question 3 in our mock paper. So this one again, we're going to ask you for the 4 marker. Remember to have done this last. Once you've done trenches, then go to the 16 marker in your medicine paper, then the 12, and then do this one last. Just in case you run out of time, it is always better to run out of time on this question than not have time for a conclusion in the 16 marker. So we are asking you in this one to explain one way in which surgery was different in the industrial period, 1750 to 1900, to surgery in the modern period, which is 1900 to today, or the present time. Remember to take the time to understand what this question wants. It will either want a difference or a similarity, and it won't always give you the dates. It might just say a period, medieval, industrial, or it might just say a century. So you need to be aware. That's one time where you do need to be aware of the different dates and things like that, so you don't mess up and get things wrong. So 5 minutes max, really. Hopefully you'll have plenty of time to do this at the end of your paper. It's easy. Don't overcomplicate this question. Some of you did overcomplicate it, maybe lost a couple of easy marks. And when you see your paper and then you look at a model answer in a minute, you'll see exactly how easy this is. So technique of it really is, instead of like, not said 2 paragraphs here, essentially 2 separate pieces of writing, one about the industrial period and one about the modern period. And because it's a difference question, we'll separate those 2 pieces of writing with whereas or however or on the other hand. And remember, all you're saying, the technique of it in its basics is what did they do or think in the industrial period and why? Just say why, because they believe this, they did this, or they thought this, or the church was in control and the church controlled everything. I don't know, something like that. And then the second one, what did they think in the modern period and why? What had changed? Scientific discoveries, attitudes, I don't know, whatever it might be. But you basically just remember in there is what and why in both of these little mini paragraphs. And that should really cover us for the vast majority of these 4 markers that they're going to ask us, okay? So just make sure that you are well and truly aware of the time and dates in this question, that you're not writing about examples from a different period or the wrong period. All right, so for example, if it asks about the Great Plague and cholera, make sure you're not giving examples from the Black Death. And vice versa, if it says the Black Death and cholera, then try really hard to make sure you're getting that right and don't talk about the plague doctors and things like that, or fumigation, things that were in the Great Plague. So it's really important that you do understand the dates of this question, and not necessarily when everything is. As long as your examples are from that period, then you will be absolutely fine. Right, let's look at some of the content that we could have used in this question. Okay, so we'll start with the first period, and the first little mini paragraph is the industrial period, so 1700 to 1900. Remember we're saying what do they do or think is our sort of focus, our script, if you like, the thing that helps us remember what we need to do in this question. So we could say things like they did surgery very, very quickly, really basic. So example, just amputations, I don't know, warts maybe, very simple things because they had to be quick, remember? And they were usually done by the barber surgeon in the early part of this period. Surgery was brutal. Surgeons were seen as butchers. They weren't respected at all. So straight away we could think about the difference there in the modern period compared to this one. And it was really painful because they hadn't yet figured out anesthetics, or they didn't even looking for anesthetics really, because that wasn't what they believed at the time they needed to do. So just quick and easy, and obviously cheap for people who couldn't afford surgery. They might be able to go to their barber surgeon. We know the conditions were terrible in the early industrial period. The surgeons used their outdoor clothing, tools were left out. We know all that stuff. So any example that you can think about related to infection and the filth, then go for it. Talk about it. But remember, 5 minutes. We haven't got ages. We're not writing an essay on this, but make sure that you do bring in some of those really clear bits of evidence and facts that we know, the equipment, the clothes and things like that. Then we could maybe talk about, depending on how you choose to go on this answer, and it could go on any path really, because the time range is so vast, you can choose whatever you want. So then we go into the 1800s, we talk about developing anesthetics and antiseptics. So we've got chloroform, we've got carbolic acid. But remember, we're focusing on one thing from this period. The question says one feature of this period, just one, and it could be anything, but make sure you stick with one. So I would advise on this, and this is perhaps where some of you have got a bit mixed up in your mock, is you've done a bit of chloroform and antiseptic, or a bit of pain and infection, just pick one. Either go for pain in the industrial period or infection in the industrial period. Just pick one of them and just tell a bit of a story about what's happened there in this period, as you can see from some of the information on the screen. And then the why. So that's what did they think or what did they do? And the why did they think that in this period? So there was initially no anaesthetic. That's the why. They had to do it quick to be as painless as possible and try and hopefully deal with blood loss, etc. They had very limited technology. So as we've said, the surgery was basic. This is the why, remember? And they have no knowledge or hygiene yet, or antiseptics. The germ theory is going to be discovered in 1861. So if you are going to do something about the advances in infection, so carbolic acid, if you pick that as your example, then a really good why is just say the germ theory being discovered in 1861, which led to Lister developing carbolic acid, something along those lines. And hopefully that makes a lot of sense to you as you're watching this. Look at your own paper and see if you've managed to do that why matching up to the what you said. I think the trickiest part, in fact, I know the trickiest part from looking at all of your papers, is a little bit of confusion about what to write. Just pick one example, either basic, painful, disgusting, infection, whatever it might be. Just pick one and then say why that happened. All right. And then we say, because this question is asking us about a difference, however, or whereas. And we move into the second period. So when we say paragraph, again, we just mean a second little block of writing, maybe 2 or 3 sentences. But again, our technique, what did they do or think in this period? So the examples we could have is surgery could take as long as needed. Because the patient is now out cold, because they've got anesthetics, chloroform, they can do whatever they want, brain, heart, open abdomen surgery, without worrying about the patient moving about in those early problems in this period, which of course has led to much more complex operations and surgery, saving more lives. Just everything is just so much better, having gone through that really painful bit in the industrial period before we got to the end of the industrial period. And I think it's important to consider as well, because this could be a topic in your summer exam for the 12 marker or 16 marker. So while we're here talking about it, remember turning points. Events that happen that change the century or period. In the industrial period, you can go far wrong from forgetting that it's the germ theory. Once the germ theory has happened, it sort of explains everything, doesn't it? So that's important to think about sort of turning points. For this 4 marker, don't worry too much. Just mention the germ theory had been discovered, which led to Lister, if you chose that. So back to the modern period then. So complex operations, highly trained and specialist surgeons. So surgeons now are very well respected. They're highly trained, of course. They work for the NHS and all of those things. The government put a big emphasis on training our surgeons and our doctors. Whereas, as we've said in the previous mini paragraph, if you chose that example, that they were barber surgeons and brutal, not respected, in fact, hated and feared. All right. So we've talked about the respect of that. Virtually no deaths in this period from infections. So if you chose infections in the last one, this is a lovely direct comparison of what's different from the industrial period to today. People don't die from infection really anymore in surgery. Surgeons are washing their tools, they're washing their hands. They know all of these things that are important to them because of the discoveries of the industrial period. Technology is better, robotics, radiotherapy, blood tests, ECGs, all those many examples of modern technology that help people live longer. You should really be quite confident in knowing that in this modern period, the technology that was introduced, which has helped us with diagnosis and treatment. All right, so if they're the what's and this now is the why did they do or think that in the 1900s to today? All right, so we've discovered anesthetics, obviously, in the previous period. We've now mastered them, how they work, dosage, all sorts of things like that. So the problems of chloroform earlier on, we've now dealt with that. And as the modern period gets on, clearly we don't use chloroform anymore, but we do still use anesthetics, and they're all perfectly measured to the patient, be it a child, a bigger person, a man, a woman, an old person, things like that. So all of those reasons are why surgery is better in this period. Very specialist technology, as we've sort of mentioned a second ago in the last bullet point of the what did they do, but this robotic surgery, and you'll see in a sec, a table of some specific examples that you really need to get into your head. And then, of course, aseptic surgery using steam. We're like 100% steam sterilized now in an operating theatre. So there'll be no danger of any operation today being done in dirty conditions that could lead to infection. So All of that said and everything on the board, if you need to, on the screen, sorry, just pause it, have a read of it, maybe make some notes on your own paper, what you tried to say, how it came out, maybe a little bit wrong. And then we'll have a look at this table just to get our head around some really specific examples. Okay, so when you've read that and you're comfortable and confident, you had a little reflection of your paper, just unpause the video and we'll look at this table. All right, so this table, just pause the video. It's from the textbook that we've used in class. These are the examples that you could give if you go down the route of new technology for this question, but also for a 12 or 16 marker, if we're saying a paragraph or a reason why people live longer, a reason why surgery is better. These are going to be your pieces of evidence, aren't they? Your E in Peel. We could talk about advanced x-rays and just put that bit next to it in your own words. Smaller, cheaper machines allowing people to self-diagnose or self-treat better. Obviously robotics. Then we've got surgical treatments, microsurgery, keyhole surgery and robotic surgery. So in response to this mock exam, make sure you get this around in your head. And then as we approach the summer for your real exams, this would be a really good a bit of revision for, I don't know, flashcards or posters or something that just gets in your head all the different types of technology that are in this modern period, because then you've got quite easily, you just need to pick a couple of them and easily rack up some marks. Okay, so take your time again to look at this and have a look at your answer and see if you can see where, if you put a few of these in, it will improve your answer significantly. Okay, hopefully that makes sense, and then we can see, and then we'll have a look in a minute at, or next, some model answers for this question.
Answers to think about. If you chose pain, it might look something like this. All right, so surgery in the 1700s was brutal and was usually performed by barber surgeons. They would only do basic surgery such as amputations and were usually very quick. This is because, so here's the why, this is because of the surgeons had no anesthetics, so tried to make the experience as quick as possible. Also, you could put in there to limit blood loss or whatever it is. Okay, and because this question here explained one way in which surgery was different, we are going to use the different word, the word that takes us on the other side of the argument, in this case, whereas. Okay, so whereas takes us on to our second paragraph, our second 2 marks hopefully. This says surgery in the 1900s was far more advanced. Surgeons were now respected and highly skilled in specific areas, for example heart or brain surgery. Operations were also more complex, for example heart transplants. This is because by 1900s surgeons had discovered anesthetics and technology such as robotics and keyhole surgery. Alright, so obviously the language isn't perfect there, there's a few grammar mistakes probably, but in stress of an exam you won't be marked down for that. But hopefully you can see we've got the what they did or what they thought and the why. It's always easy to do the why when you say this is because. Okay, so the next example, if you didn't want to do pain, you could choose to do infection. Okay, so infection, we'll start with the 1700s. Surgery in the 1700s was done in filthy conditions. The surgeons would often do their operations in their outdoor clothing. The tools of the surgeons were also dirty from earlier operations or dissections. This is because there was no knowledge of germs or antiseptic in the 1700s. So there's my why and what. Whereas, so again, we're saying something different. If it was similar, we would say similarly. In this case, we're just saying different. All right, so we would then say surgery in the 1900s was aseptic. This means it was 100% germ-free, using steam to sterilize the operating theatre, after every operation. Tools were also washed or thrown away after one use. Surgeons washed their hands before every operation. This is because there had been a massive breakthrough in knowledge and understanding of germs and technology by the 1900s. So again, there's the what and the why. So if you look at yours, if you pause these videos now and these 2 model answers and have a look at your answers, hopefully you'll be able to see where you've gone a little bit wrong and what you need to do for that second mark. Okay, so there's the easy bit. Now we get on to our essays, the 2 big essays that require the biggest time. So question 4, the 12 marker. And we've done a lot of practice of the 12 marker in class and for your homework, especially in year 10. 3 paragraphs, just 3 Peel paragraphs on what's happened. Explain why something happened. Same question in Elizabeth paper, same as in Germany. So explain in this case why life expectancy has improved since 1900. So again, we're looking for about 20 minutes on this question, depending on how quick you've done the other ones. And we just simply need 3 Peel paragraphs. Okay, so general feedback on this question before we do some specifics. Time management. Just remember those time management. Whatever's happening, stop after 20 minutes and then move on. You need your 3 PL paragraphs. Some of you only did 2, some of you only did 1, some of you did sort of 3 mixed into one big one. Make it really easy for the examiner to see where your points are. You do not need an introduction or conclusion for the 12 marker. You haven't got time, just get straight into it. That was a bit of a problem for generally for most of you. Lots of you did an introduction in this question. Okay, so in the 12 marker, no intro, no conclusion. All right, remember to start every paragraph with a very clear point sentence. Make it clear to the examiner what this paragraph is about. So for example, we could say one reason why life expectancy improved since the 1900s, and we're using the words of the question in there, is the introduction of the NHS. So we've got a point straight away and a mark, because we're making it clear this paragraph is going to be about the NHS and how that's helped people live longer. All right, so then we follow that up with our evidence, or 3 facts within a paragraph. Remember, you're just aiming for 3. When you've given the example related to that point, we'll then explain why that's helped people live longer. So the example in this case is the NHS brought access to health for everyone, rich and poor. That's one of my 3 examples, that access to healthcare was now for everybody. All right, I could give another example in a minute about before the NHS, only the rich could have healthcare. As long as you say the example and then how that's helped you explain. So to explain why my example has led to people living longer, as a result, there's one of our common connectives, remember, or this led to, or any of those things that help you say, explain. As a result of this access to health, so I'm reminding the examiner that my example was access to health. People who previously would have died from basic illnesses because they couldn't afford to see a doctor could now get treated. And then I'm going to link to the question and say this meant that people were not dying younger anymore, so leading to a longer life expectancy. So if we can do that 3 times in a paragraph, we are absolutely nailed on, going to be getting our 12 marks in each paragraph. Okay, some paragraphs may be a little bit tricky. You may not be able to get 3, that you need to try and get in the habit of giving that bit of evidence, that fact, saying how that fact helped people live longer in this case, and then linking that back to the question, why are people living longer? And then the next one you could possibly do is some of the services in the NHS, all within this NHS paragraph. So a GP or A&E or paramedic or dentistry or whatever it might be, that could be your second fact, and then talk about why that fact has helped people live longer. All right, so hopefully that makes sense. Obviously, just pause the video and reflect a little bit on the words. Maybe replay if you haven't quite heard what we're saying. But it's a technique feature, this one, definitely, to try and ensure that we do get our maximum marks for this question. All right, so the bullet points in every exam for Edexcel, remember, they'll give you some bullet points to help you out. They are there to help. I mean, you don't need to use them, but in this case, I certainly would think about using them, okay? So they offered us today, or in your mock exam, they offered the development of penicillin as a paragraph. So that's Fleming's discovery. And they offered the second bullet point with the government actions, so education, campaigns and laws. So that's quite an open paragraph, quite a lot you could say in that one for sure. And then you have to use a third reason or third paragraph of your own. In this case, you could have chosen from these examples now. So you could have chosen an introduction of the NHS. You could choose advances in surgery. You could choose technology used for diagnosis. Or you could choose the vaccination campaigns for diphtheria, polio and COVID. But anything else is valid as long as it's since 1900. Now, quite a few of you got yourself mixed up a little bit there, and we're talking about the Public Health Act and things in the 1800s. This question says since 1900, okay? So this is what you could do. If you choose to do a penicillin paragraph, these are the factors, remember, that contributed to penicillin. So you want to be saying something along the lines of penicillin was discovered by Alexander Fleming. There's a nice little fact. Don't go mad on the story, hours and hours on how he left his dish out. Just that he discovered it and he realised that this mould killed bacteria on his dish. You need to get the word antibiotic into this paragraph. That's really key. I feel like a lot of us miss that out. This is an antibiotic. This is a new discovery, a new drug, a new treatment that cures all infections, pretty much all bacterial infections. And remember, we're going to try and argue why this means people are living longer. Is because before penicillin, people were dying with just simple infections from, it could be a prick from a thorn on a flower, a rusty nail or just a wound that got some dirt in, that was killing them. Whereas now, almost certainly every single person is living longer because they were treated with this wonder drug, this penicillin. All right, and also remember the idea of what a magic bullet is, or what the antibiotic is it attacks the bacteria in the body, not the cells. For years and years and years, remember they were using mercury to treat syphilis, which was destroying the cells in the body, causing probably more damage than the actual infection. So get all that in there and how that's helped people live longer. You could as well, if you wanted to, put the magic bullets into this paragraph. Just gives you a little bit more to write about, especially when we're trying to get those 3 examples. All right, so that was one they suggested, and hopefully quite a straightforward one. Try to get your example in there as well about World War II, how they used penicillin on the beaches of Normandy in the D-Day landings. Okay, it's quite a nice little fact to get in, and of course you then say all of those soldiers, they would have died before, now they survived. Okay, so that's quite an important one to think about. Just a slight careful point, and you're not wrong as such when we talk about antibiotics and penicillin as a prevention. We just don't want to get confused in the idea that penicillin was used as a prevention like a vaccine is, where it gives you a small amount of the virus so your body can fight it off. Generally speaking, penicillin is a treatment for a bacterial infection. However, if you are going to use the term prevention, give the example of how they give you some penicillin after surgery or after you've been to the dentist or something, just to prevent a potential infection coming. So yeah, it is technically a prevention, but it isn't a prevention in the sense of a vaccine that we've talked about in the past. All right, and a couple of common mistakes here is that penicillin is not an anesthetic. So please be careful when you say those things. But like we say, that's what mocks are for, to get these little mistakes out, and then we can get that fed back to you. All right. So you could, as I say, put magic bullets into that paragraph as well. Just talk about the first 2. The idea being this new discovery is allowing scientists to attack different and specific bacterial infections, which was a far cry from whatever came before. People were dying dead simply. And of course, penicillin being the ultimate magic bullet, the one that treats everything. So you can pause the video here, have a little reminder of the first 2 magic bullets, Salvarsan 606 and Prontazil. And then there's a third little example there during World War II, but we've got plenty there, haven't we, with penicillin, Salvarsan and Prontazil. Okay, so when you're ready, just press play and carry on with the video. All right, so another paragraph that you could have picked was the government campaigns and education and laws. So again, a massive paragraph, far too much for you to write everything about, but definitely enough to get you 3 examples. All right, so the vaccine campaigns from the government, you could talk about polio, diphtheria, and of course COVID. Our course says to today, so 1250 right up to today. So of course we could talk about the COVID vaccine campaigns they did, how they brought them to schools. We tested in schools, test and trace, all of those things. You went to get your vaccine, and that allowed us to go on holidays. Whatever. Don't go mad on all the random details about it, but keep it really focused on why this meant people live longer. We know, don't we, that vaccines are probably the best invention or discovery in human history, because so many of the illnesses like smallpox and diphtheria and polio, they have all but gone because of vaccines. So that's why people are living longer, because in the old days, before the 1900s, people were dying of very, very simple illnesses. Okay, quite sad really when you think about it, but that's how it is. So you could also talk about the lifestyle campaigns and the laws that the government have picked. Again, we need 3. So smoking bans in public places from 2007, the Stoptober, Change for Life, so the sugar counter, the apps that you got maybe in school, in primary school, healthy eating adverts showing how bad the damage can be from smoking. Be specific in your dates of all of these things, okay? They have led to a reduction in lung cancer, hence that's the point you need to make, why that means people are living longer. So lung cancer in the 60s was a massive killer. And throat cancer, but because of these adverts now, as we get more into the 21st century, less and less people are dying from lung cancer and throat cancer because less and less people are smoking. So these adverts and these campaigns have definitely helped change people's lifestyle. Also in this, you could talk about the lifestyle choices that we know about. So eating too much sugar gives you diabetes. We know a lot more. We know so much more now, which is because of education probably. The internet, and of course education. So this doesn't mean teaching doctors, which some of you have said. This education programs from the government means what you learn in school. So you are learning in PSHE about the effects of drugs and STDs and smoking. So that's hopefully going to mean that when you're older, you're going to make better lifestyle choices, which will ultimately mean you're going to live longer. Hence the question, why are people living longer? This is quite a nice example. The Clean Air Act of 1956. A couple of you got this a bit mixed up with the Smoking Act in public buildings. The Clean Air Act of 56, a long time ago, was to stop people lighting their coal fires at night. They recognised that the pollution and the smog in London, especially, and the big cities, was making people sick with asthma and things like that. So by stopping people lighting their fires, that improved pollution. And again, we're linking back to that question all the time. This is why people lived longer. Okay, so this is a nice little graph just to remind you, really, when thinking about the government campaigns, you can see the deaths have plummeted by 2000 because of the work of governments. Okay, so we've got the diphtheria, tuberculosis, smallpox. All of this government is spending money on the scientists and the campaigns, the vaccine campaigns, making them free for everybody. That's just a really good little diagram that you could add to that paragraph if you wish. Okay, so if you did choose that paragraph and you haven't perhaps got loads of marks, maybe listening to this video you can see why you could have said a few more examples. Some of you just managed to get one example of government campaigns perhaps. You said the no smoking in public places, and then sort of that was it. You need to try and fill these paragraphs full of these facts, and then of course remember to explain how they have made people live longer. All right, so then you could choose, and if I was doing this question, I think I'd have chosen this paragraph. The advances in diagnosis or diagnostic technology. You can see in this image on the video, there is loads. We need 3, remember, so you need only 3 of these things. I would definitely choose the blood sugar monitor because you can relate to that. You've got friends in school or people in our school who have diabetes monitors, blood sugar monitors. This tells them if their blood sugar is low or high. Without that in the past, of course, they would have had some sort of diabetic consequence. Blood tests, we now do blood tests. They can tell us pretty much what's wrong with us from our blood. Endoscopes, they can get cameras inside of us. ECGs might measure our heart rate. X-rays can show us where things are broken. MRI scanners, all of these things. You could just pick 3 of them and basically just write a paragraph on how that's kept people alive, because we are diagnosing problems that once they get too far, they are generally too late to treat. Whereas now, with all of this technology, we get these things early, including cancers, of course. We can treat them early. So you're looking at things like the text there. You can see diagnostic technology, especially chemotherapy, radiotherapy for cancers. Great treatments, but we can now do that because of the early diagnosis. Okay, keyhole surgery, robotics, things like that. So that would be quite a nice paragraph. Nobody did that, so maybe that's something that you might think about when revising or when you're doing your practice question booklets and this question pops up again. All right, so advances in surgery. So slightly different from the last one, but if you wanted to, you could probably merge them all into that one paragraph and definitely get your 3 facts. So advances in surgery, microsurgery, keyhole surgery, robotic surgery, prosthetic limbs. You can pause the video and have a little read of that yourself. Dialysis machines, that's the thing that people need to sit for hours in a hospital to make sure their kidneys are working, whereas now you can take these things home with you to flush out all the toxins from your body instead. Just really, really fantastic inventions that have made people live longer. Okay, so again, pause this if you want to have a look at this one, if you think, oh, that's one I might like to do. But there are loads. So the next possible paragraph you could have picked was, of course, the NHS. We'd expect you to pick the NHS as one of your own paragraphs. Anything really that's relating to health in the 20th century has got to be the NHS, hasn't it? So the gist of the NHS, the key feature of it, as I gave in my example before, is this now offers access to healthcare for everybody, no matter how rich or how poor you were. And in a question like this, which is asking you for since 1900, what was it like before? Why is it better? You need to give a little bit of information about what it was like before. And basically, poor people with simple illnesses died. Their living conditions were poor, so they got sick really easily and spread it around the house, remember? Also, the NHS is really good for early diagnosis, surgery, drugs, the chemist. Just keep saying all of the time, why have these things kept people alive, living conditions, why are they living longer since 1900? Try to give examples of the services offered by the NHS, so general GPs, dentists, you can see hospitals, A&E, paramedics to get you to hospital, all sorts of things, health visitors, mental health. In your exercise books, you've got a little task, remember, that listed hundreds of services that the NHS offer, all for free at the point of use. Quite an incredible system that has, of course, contributed to keeping people alive for longer. Okay, so that's one you could have picked there. So with that said, that was the 12 marker. You can clearly see that there was, for that question, a lot to say. One of the biggest things to think about there is that a lot of you have missed the since 1900 bit. Just don't do that. So now it takes us on to our judgment time, the big question, the 16 marker, or 20 if you add on your spag marks. This needs the most amount of time, so about half an hour we'll need on this. So as always with the other questions, let's look at a little bit of general feedback. So remember your time management, about 30 minutes on this question maximum. Start with this one and then work your way backwards, please. You'll need 3 peel paragraphs, exactly the same as the 12 marker. Okay, the only difference really in this question is within those peel paragraphs you generally will be comparing to something else. All right, so to the focus of the question. So instead of just saying why something happened, you'll be saying why this was good and why was it better or worse than somebody else. Because it's an analysis question, this one. It requires an awful lot of analytical language. You do need an introduction and you do need a conclusion on this question. So essentially the 12 marker with an intro and a conclusion. So your introduction should be very, very clear whether you agree or disagree with whatever the question is asking you. So the easiest way to do this without overcomplicating anything is to say I agree or disagree to a larger or lesser extent with the words of the question, whatever the words of the question are. Okay, it's easier to just say agree or disagree to a larger extent. If you disagree, then obviously you don't need to say lesser because you disagree to a larger extent. It means the same thing. So there's some things we can do to make our life a little bit easier. This is one of them. A nice, clear, opening sentence. I agree or disagree to a larger extent that. Okay. And then within your introduction, this is the tricky bit that's probably worth maybe the top 2 or 3 marks out of the 16. Try to give a brief reasoning for why you agree or disagree. Usually it'll relate to the impact of a person or a discovery or how big the change was, or was it knowledge, or was it a new treatment, a cause or prevention. You decide. And this is the good bit about this question is once you've set your criteria, then no one can say you're wrong. You just then need to prove why your criteria is more important than the others. Okay, so it could be a little bit like, I think in English we've talked in class, haven't we, how this might be your thesis statement. Okay, so that's what you need to try and do in your intro. You disagree to a large extent or you agree to a large extent and say why. That will hopefully be a little bit clearer as we talk through some of the possible things you could have talked about in this question. All right, and then start your answer really clearly with that signposting. Remember that language. Okay, so on the one hand, it tells the examiner, this is the first half of my argument, supporting one side of the argument. All right, then if you are a 2 verse 1 essay, which we'll talk about in a minute, you'll need a second paragraph that continues that support for the question. So you're going to have 2 examples to support that side of the argument. You'll see exactly what that looks like in the next feedback session. Question, if you did Renaissance or not, it doesn't matter. Continue to watch the video. And then, of course, to flip it onto the other side, when you then flip your argument, start the 3rd paragraph with on the other hand. This makes it really clear to the examiner that you've now moved away from that side of the argument onto the final side. Try to use language like, if it wasn't for X, then Y wouldn't have happened. Despite X happening, Y was more important. That kind of analytical language, the thing that you're trying to argue that, okay, I accept that's good, but it's not as good as that because, and it's usually generally it's about impact, those kinds of arguments. All right, and then your conclusion. In this conclusion, it's a nice way to end the question. Make it clear why you're correct, why your judgment, you're right. Why did you agree or disagree with that opening sentence that the examiner asked you? Lots of comparison in the conclusion. You're sort of summarising what you've said in those 3 paragraphs, and you're constantly comparing. Although this happened, this was more important because, and despite this, maybe it might be something along the lines of Florence Nightingale's work was only relevant if you were in hospitals, whereas the Public Health Act affected everybody. Something like that, to try and get all of that into your conclusion. Okay, so that's general of the 16 marker, and that's really very similar to the Elizabeth paper as well. So once we get the technique of the 16 marker into our head, then it really will help with the Elizabeth paper too. All right, so the first question, whether you did it or not, please still watch the video because this gives us an example of a 2 verse 1 question. It says to you, the examiner's told you there was no progress in the Renaissance, and it's asked you, do you agree or disagree? Okay, so quite simply, it's easy, yes or no. So you're going to start this 2 verse 1 essay thinking about, right, maybe do a little plan on your paper, not too long, just a quick scribble of your things you want to talk about. This question is quite clearly, you'll need 2 paragraphs that say there was no progress and 1 that says there was, or if you disagree, you'll need 2 paragraphs to say why there was progress and 1 to show why there wasn't. That's what I mean by the 2 verse 1 essay. I prefer this one. I think that's a little bit easier, this one, because you can just essentially go mad on one half of the essay and then introduce the alternative side in just 1 paragraph. All right, so in this case, if you do agree with this statement that there was no progress, you will need 2 paragraphs to support that and say how the Renaissance was not good, all right, for progress, and you need 1 paragraph to show that there was some progress. On the flip of that, obviously, if you disagree with that statement, that there was no progress, then you will need 2 paragraphs to argue against that statement, so why the Renaissance was a good period for progress, and then you'll just need 1 to show that there was a definite lack of progress. For what it's worth, on this question, I would absolutely disagree wholeheartedly to a much, much larger extent that there was no progress in the Renaissance. And the reason why I would disagree with that is because I value knowledge. I believe that although there wasn't any new treatments, causes, or preventions, I feel like the knowledge that was gained in the Renaissance period was the springboard for all future discoveries and treatments and causes. So without this period, they wouldn't have been able to do what they did in the industrial period. So that would be my criteria or thesis statement, if you like. Okay, the bullet points will always, in the 16 marker, give you 1 of each side. So if you do both the bullet points, then generally speaking, you've hit the mark scheme target of 1 of each side, and then you just need a third of your own. So let's have a little look then. If you choose to agree with the statement, the Renaissance was poor, these are the possible paragraphs that you could talk about. So firstly, you could make your point that on the one hand, remember we're starting our essay with that really clear, this is my side of the argument that says that I agree. You could say that there was little progress as they still used old medieval treatments in the Renaissance. So this paragraph now is quite clearly going to be about medieval treatments that we're still using in the Renaissance, and there are many. So just getting your 3 facts in this should be easy. Starting with bleeding and purging and herbs, there's your 3. Just go on to advance those a little bit onto how they show progress. Or no progress, sorry, how they show that things aren't good if we're still doing those same old ideas. If you want, you can mention that there's some new herbs coming from the Americas and some chemicals, but generally speaking, it's still going to the apothecary, still getting your herbs, and they're still treating based on the 4 humours belief. So that definitely is a really good paragraph, isn't it, to show that they don't know, there has not been progress in the Renaissance because we're still doing those old things. All right, your second paragraph, and again, we're going to say furthermore to introduce paragraph 2. So I'm going to give you more examples now. This paragraph is another one to show why the Renaissance was poor. The way they dealt with the Great Plague shows there hasn't been any progress since the Black Death. So now this paragraph can be all about the Great Plague, what they did in the Great Plague, preventions, treatments, causes, whatever. That is still the same as it was for the Black Death. So they're still praying, there's still charms, there's still pilgrimages. So it's important to note, though, in this question, the church is losing its influence and power, but it still was there and people were still religious. Okay, so try and choose some examples of the Great Plague, what they're doing there. Just as an aside, just to maybe confuse things a little bit in this bit, if you were going to use the Great Plague to show progress on the other side, then you're going to talk about the red cross on the door, the cleaning the streets, and the plague doctor. There's 3 new things they did, although I still, me personally, would put them in this paragraph because they're still wrong. They still weren't right. So even though they're trying new things, they still weren't correct and they still didn't know the cause of the plague. So we got 2 nice paragraphs there to really get the point across that there was no progress. And then the third one, if you needed it, you could say how they didn't really show much progress in moving away from religious ideas, preventions like the Regimen Sanitatis. There's still nothing new in the sense of treatments or preventions or causes. Similar to paragraph 1, really. You could maybe merge that one up there. Okay, so hopefully that shows you, if you chose to agree with this statement, the sort of area you should be talking about. So for me, I disagree, so I would only pick one of them. So this judgment, if you chose this side, is basically because people are still dying, the same illnesses, no one's living longer in the Renaissance. That is generally going to be what you're concluding on there. Okay, so then to flip it over, so to disagree, the Renaissance, here's all the possible paragraphs you could pick for this. And hopefully by now you'll see, when we get through this next bit of the video, you'll see there's a lot more for positive. Okay, so you could talk about how the church has lost its grip and control. Although people are still religious, don't credit the church why it limited progress as if you were talking about the Middle Ages. Remember, we're in the Renaissance, so don't go down the idea of controlling universities and all that stuff. They didn't, not in the Renaissance, okay? You could also bring in Thomas Sydenham, so maybe a paragraph on individuals. So Thomas Sydenham, he argued every illness has its own cause, therefore its own treatment, fundamentally challenging the theory of the four humours, changing attitudes, and we mean attitudes of society, not just a few people. He's looking for better ideas. In fact, everyone was in this Renaissance period, weren't they? This rebirth, re-enlightenment period. He's writing his patient's details down. He's writing books that then go into university. They replace Galen's books, his medical observations book. So he's observing and he's learning from experiences. He's encouraging those experiences. Remember, he offered get well, you should just have some rest, some roast chicken, some red wine, everything in moderation. So a really sort of logical way forward. You could also then pick Vesalius. I definitely would, absolutely would. His knowledge of anatomy is finally challenging and proving Galen wrong on 300 counts. But remember to give an example of some of those things that he proved Galen wrong on. The jawbone only being one bone, men and women having the same ribs, etc. But be sure that you're saying why this is progress, though. Remember that link back to the question all the time. His book, The Fabric of the Human Body, ends up in university, absolutely replaces Galen's book. His images, his pictures that were in those books are scale, 3D, realistic, everything a surgeon needs or a physician needs when learning about the body. And the printing press, of course, helps with that. And Vesalius inspires future doctors. So another individual, it seems, in this period to show progress. You could pick William Harvey. He proves the heart to pump, suggesting the four humours is wrong and the treatment of the four humours is wrong, even though it took 50 years for people to actually believe him after he died. But he's beginning to change treatments, change attitudes, and the knowledge of physiology. Remember how the body works, not just where everything is, what Vesalius did. But Harvey's only doing what he did because he was inspired by Vesalius. And of course, Harvey's book as well ended up in the universities replacing Galen's. So really, at the end of this period, Galen's gone. And that's why that's such an important bit of progress, because as long as Galen's around and his ideas are around, his books in the universities, then we're not making any progress at all, are we? And then finally, I might choose a paragraph on the Royal Society. You know, they do experiments, they share their ideas with everybody, they print leaflets, they end up in the taverns, the pubs, people are talking, that improves literacy, essentially challenging all these old ideas and making new discoveries all the time. Some really random experiments, maybe like a blood transfusion from an animal to a human. They found animalcules using their microscope that they invented. And of course, they had the support of the king, hence the name Royal Society, which gave them some legitimacy, I suppose. And they're sharing their ideas with the printing press. The printing press is obviously really important. I wondered if you could probably see a paragraph here on just technology, the printing press and the microscope, and that could bring in all of them other examples, I suppose, couldn't it? Vesalius' books, spreading ideas. And again, the Royal Society is doing that thing where this period is about changing attitudes. Many people are looking for better answers, and of course the rise of that humanism as well, remember. So sort of a challenge to religion in that humanism is about answers, seeking new ideas. So I don't know where you feel now after watching this, if you would change your mind now. To me, it seems like there's a lot more to disagree with this statement, to say that actually the Renaissance was quite a good period of progress. However, the gist of this, again, essentially, if you do disagree, you're going to be saying this is because you think knowledge is progress. And that's more important than perhaps people living longer or new treatments, causes, or preventions. But you can't be wrong because it's your opinion. Okay? So then our second choice for this one is Florence Nightingale, which most of you did do. So again, the statement from the examiner is that Florence Nightingale was the most important for advances in hygiene by 1900. Do you agree? All right, so it's asking you straight away to think, do you agree? Now, this one is not a 2 verse 1. essay. This is a little bit different. This is going to be a three-way answer. So one paragraph has to be Florence Nightingale because she's the focus of the question. And then your other two paragraphs will be someone or something else that you think has had equally a good impact on hygiene, all right, but less or more than Nightingale. So all three paragraphs are going to be positive in why progress was made towards hygiene. The focus of the question is hygiene, okay, so don't lose focus of that. So like I say, it's a three-way argument, which means you'll need one on Nightingale and two others. It could be two more individuals or a government or science technology, whatever you choose to do. Another thing that's important on this question is it says by 1900, unlike the 12 marker that said since 1900. So don't put anything in this essay about the NHS or anything because this is by 1900. All right, you'll be given paragraph 1 because it's the focus of the question. Whatever they're asking you, if it's about Jenner or, I don't know, Vesalius or the NHS, whatever it is, whatever's in the statement, that has to be paragraph 1 because the other two paragraphs will then need to be directly compared to paragraph 1. This is more important than paragraph 1 or less important. So it's really helpful if you do the focus of the question in paragraph 1 if it is a three-way argument. Okay, and then you can choose any two you want. The bullet points will make suggestions, which we'll see in a sec, but you can choose any that you want. Once you've done Florence Nightingale, you can pick any, but they must be directly compared to the focus of the question. In this case, it's Florence Nightingale. In all the way through your other paragraphs, despite the fact that this happened, it's more or less important than Nightingale's work because all the time. Okay, your intro again should be really crystal clear. I agree to a larger or lesser extent that Florence Nightingale's work was more important in hygiene. And if not, if you disagree, then say what is more important, okay? But make sure you give a definite judgment about what's more to blame, all right? Or more important. So let's see what you could have put. In this Florence Nightingale paragraph, you can see on the video, there's plenty. Again, we need 3 good examples well explained. You definitely need to be talking about Nightingale's hospital design. The pavilion plan, the open, big windows, tiles, so they're easy to clean, the wards to stop contagious diseases. You need to definitely be talking about all of that for sure, because that has absolutely helped hygiene. And you can see in the yellow bit here in the video that hygiene is a massive theme. All right, it means in general, not just in hospitals, but anywhere in the street, in your house. The knowledge of hygiene today, who are we giving credit to for that? All right, so you then might talk about her notes on nursing, but make sure it focuses on the profession and the nurses going around every day, cleaning the wards and looking after the patient. Don't get too distracted on anything other than hygiene in this question. You might want to talk about her work in Scutari. Obviously, you know the old Horrible Histories video, slipping on the poo, lifting the bed sheets in, tucking the bed sheets in, regularly checking, cleaning, using her own. She spent her own money, didn't she, on brushes and stuff. And she went, the death rate in the Crimean War went from 42% down to 2%. So a nice little fact. Keep on that focus of hygiene though. So you're saying how all of these things that Nightingale did improved hygiene. What was their impact? How far did Nightingale's work go? All right. Did she influence or inspire anybody else? We know that Nightingale's notes on nurses form the basis of nurse training today. We know a lot about hygiene now in our house. We keep everything clean. We know we have to wash our hands. If you're going to give credit to Nightingale for that, then absolutely, for sure, that's what you'll say in this paragraph. All right. And also, if you do want to give Nightingale a little bit more credit, she did all of this before the germ theory was discovered, remember, and before the Public Health Act. So in a minute, you'll see that those two are probably the two obvious counter arguments to hygiene, aren't they? But the fact that Nightingale did this before all of that knowledge sort of gives you she gives her a bit of kudos, doesn't it? A bit more a sort of sway in the argument. So then if we are going to say, on the other hand, Louis Pasteur's germ theory was more important, then that image on the screen right now gives you a bit of an idea, a reminder of what it was. The old spontaneous generation idea was that the germs, the rotting, caused the germs, whereas the germ theory was, no, that's wrong. The germs are always there in the air, and they are the ones that cause the rotting and the disease. So this is what Louis Pasteur's summary is, that germs are everywhere. Okay, this leads to the end of the laissez-faire attitude of the government. So you're saying here that Pasteur's work inspired, presumably, the Public Health Act, but it's changed the government's attitude. The government are now going to do more to keep the people healthier. You'll see in a second with the example for government action, closing down the slums and the Public Health Act and things like that. So without Louis Pasteur, you would say then maybe the Public Health Act wouldn't have happened. So that's the analytical language that you need to be doing. It's also inspired Lister. Lister was very much inspired by Louis Pasteur's papers. Lister, of course, did his work on carbolic acid and surgery. So again, you could do that, and you'll see in a minute that's an option as a paragraph. It's a bit more difficult, a little bit of a smaller paragraph perhaps. But again, you might say that Lister was only based in hospitals during surgery. Although in saying that, we all have antiseptic wipes in our house, don't we? Antibacterial stuff in the house. So maybe Lister's is more important than that based on impact. All right. And of course, Louis Pasteur's ultimate gift is changing attitudes in society. His work has confirmed why Nightingale was correct. So that could be your argument that he has proven Nightingale, she didn't know what she was doing, if she was more lucky. The language you choose depends entirely on what you're trying to do in your argument. Okay. So essentially, this discovery proved there were germs everywhere. We now knew the cause of illness, which can lead to new preventions and treatments. Washing your hands, basic things like that. So the impact of Louis Pasteur is huge. Whether it's bigger or less than Nightingale, that's up to you. Just think about impact in your analytical language. All right. And then the third obvious counter argument to Nightingale would be John Snow and the Public Health Act. I suppose you could keep them both separate. I'm going to say put them all in one paragraph here, so that gives you definitely plenty to say. So John Snow's discovery of cholera being waterborne begins changing attitudes. He starts putting pressure on the government even way before Louis Pasteur's germ theory. He was saying to the government, look, this is proof that people in poor living conditions are dying of cholera. You need to do something about it. So maybe John Snow is even more important than Louis Pasteur. This is all why this question is quite fun, because you get to go down a few little rabbit holes. But again, John Snow is challenging this laissez-faire attitude. And ultimately, by 1875, the Public Health Act happens. The government pulled down the slums around the country. And I think that was largely to do with John Snow changing attitudes. But if you wanted to counter that, you could say that John Snow's impact was really, really small. It was only in Soho, wasn't it? It was only in Broad Street, that one pump. But it depends. You can twist your argument any way you want to help your argument. Okay? And then the Public Health Act obviously gets some examples in there of all new houses need the fresh water supply, indoor toilets. We've now got sewers as well. An actual sewer system in London finished in 1875 as well. So the government absolutely understanding now the importance of getting away waste and filth from the streets. All of this has played a part. John Snow has played a part. The Public Health Act is the sort of defining moment of the end of laissez-faire. The germ theory has probably helped the government make this decision. And of course, Nightingale's results, 42% is insane, isn't it? So the government have got a lot of sort of facts to deal with here to accept, ultimately ending up in this period of hygiene, really. I guess what I'm saying is it's quite a tricky answer, this one, because you've got to try and decide somebody is more important. All right, so all the time within this paragraph, remember you're saying why this is more or less important than Florence Nightingale. And as I said before, you can throw Lister in here with his antiseptics if you want. What did he do? How did he discover it? How that helped in surgery, cleaning the equipment, soaking the patient. Don't worry too much about the problems of it. You could maybe get a little bit of problems in there if you're trying to say why he's not the most important. But basically, his discovery of antiseptics has had a massive reach, hasn't it? Like I say, not just in surgery, but in our houses, in our schools, in our hospitals. You know you can't go in hospitals anymore without hand wash on literally every door because they now know this. Perhaps Lister is more or less important than Nightingale. I just don't know. It's up to you. Okay? So the conclusion ultimately there is everything has to keep coming back to Nightingale's work on hygiene. Argue why you think she is most important or why someone or something else is more important. Remember that we're focusing on hygiene, okay, in this question. So thank you so much for watching this, and hopefully it's proved helpful, even if you you've watched it a little bit over time, into breaking down your mock results. Remember, all of our lessons are on stchistory.com. Just make sure you click on the Year 11 section with revision, videos, and the lessons. So you should have plenty to get on with, and on Google Classroom, remember, there is the one-stop shops. As always, though, please remember Wednesdays are our drop-in nights. If you've got a specific question or you want to just go over some bits and bobs, and we'll try and talk to you generally about your feedback, but this is by far the easiest way to get this detailed feedback to you in your time, rather than trying to do it in a lesson where everyone's asking lots of different questions about what they did or didn't do. So hopefully this has been helpful. If you need anything else, please just let us know. Thank you, and we'll see you soon.